Good afternoon, everyone. My name's Leanne Wells. I'm the CEO of the Consumers Health Forum of Australia. We're the national peak body for healthcare consumers and also those with an interest in healthcare consumer affairs. We're hosting this webinar from Canberra, so I'd like to acknowledge the Ngunnawal people as traditional custodians of the ACT and surrounding area, and pay my respects to their elders, past, present and emerging. So welcome everybody. We've got several people interested in this webinar. We've got broad interest, welcome. It's a special webinar that we've called Not Going Viral. So how the community has responded to the impact of the COVID restrictions on our lives has been a key factor in Australia's success to date in quelling the spread of the virus in our community. But how we perform as restrictions ease will be crucial and a more complex challenge. As restriction boundaries change and become more flexible, and we're all welcoming of those, it will place more responsibility on individuals and communities to make the right decisions. And most would agree that some aspects of healthcare delivery have changed for the better as a result of the crisis. The pandemic has created the opportunity in many of our minds to reimagine and recreate the way we do healthcare in this country. But that will need new policy or change policy, new and changed programs and ways of delivering services. So to discuss these issues further and answer some of your questions, we're joined today, and we're delighted to be joined today by two of the Deputy Chief Health Officers that have been part of leading the national response to COVID-19 in Australia, working from the Australian Government Health Department and advising the National Cabinet along with others on our national response. You've no doubt seen them give regular televised updates, and we all tune in very anxiously to those, and certainly have done over the last 3 months to get our updates. So both have extensive CVs. By way of introduction, I will give you the potted version in the interest of time so we can get into the conversation. So we're joined firstly by Professor Michael Kidd. He's the Principal Medical Advisor to the Department of Health and Professor of Primary Care at the ANU here in Canberra. He's worked as a GP for the last 30 years, past president of the RACGP, and has had several international posts, including with the WHO. We're also joined by Dr. Nick Coatsworth. He brings together two of the most important factors in the fight against the coronavirus. He's a respiratory specialist and infection disease specialist. He's got extensive experience in humanitarian, health emergencies and disaster relief around the world. So welcome to you both very much, and thank you so much for your generosity with your time. So just some housekeeping first. We've disabled the chat function on Zoom today, but if you'd like to submit questions in real time, we're welcoming of those, and we'll put those, or put as many of those, to Nick and Michael as we can. You'll just need to use the Q&A function at the bottom of the toolbar where you find the chat function as well. We've also collected questions from participants prior to this call today, and we'll do our best to work those through as well. Any technical difficulties, just email info@chf.org.au. So we'll be keeping things conversational. We'll spend the first 20 to 25 minutes or so asking Michael and Nick to respond to a couple of key questions that we were keen to put to them on behalf of our members and networks. Then we'll go to your questions, both from the QA function and those that were sent in prior. So I'm sure we've got more than enough to fill up our hour with those, with that format. So Michael and Nick, if I could put the first question to you both. What do you think the key factors have been behind the success of Australia's response to the COVID-19 pandemic thus far? Michael, do you want to?
Yep, sure. Thanks, Leanne. Just check that you can hear me okay and that everything's working.
Near this end.
Yep, that's great. Thank you. So firstly, thank you to the Consumers Health Forum of Australia for hosting this webinar and inviting us to take part, and thank you for the great work that your organisation does, supporting the consumers of our healthcare system and working with the government to strengthen Australia's healthcare system. So what were some of those factors which made a difference? It'll be interesting to see if Nick and I come up with the same list. But I think the first thing is there was a degree of luck in Australia's response, in that we weren't the first country where this appeared, and we were able to watch and see what was happening in other countries around the world as the pandemic started to evolve, and we had that opportunity to start to prepare our own nation and our own health system. As we saw what happened in China, then South Korea, across other parts of Asia, into Iran, into Italy, and into Europe. Secondly was that this decision that was made to close our borders very early in the process, and earlier than the WHO was willing to recommend, and initially doing that for people from China and then from those other countries as the pandemic evolved. And then the decision to put people into quarantine. And it's interesting because even with the very low numbers that we're seeing of people with being diagnosed with COVID-19 at the moment, many of these new diagnoses are still with people returning to Australia from overseas who are being kept in quarantine. And of course, if those people had just been arriving and going out into the community, we'd be seeing continuing spread occurring. And then the last factor that I want to focus on is actually the personal responsibility that everyone in Australia has taken, right from the Prime Minister, the Health Minister, to all of us, and the decisions that we've all made to protect the health and well-being of our family and our loved ones, but also to protect the health and well-being of the entire community of our country. And I think that we've been very fortunate also in that things have been so cohesive at a national level, that creation of the National Cabinet, the decisions coming down from the national body of the Chief Medical Officer and the Chief Health Officers of each state and territory, all these factors all being aligned, I think have resulted in the result that we've seen so far. But of course, we can't get complacent at the moment.
I will... Michael's stolen the top three, of course, and I concur absolutely with him. But I can elaborate on my own experience. So I arrived from the Canberra Health Services on the 23rd of March, and that was really a seminal time for the country and for the community. Two things that I was really impressed with. I've seen a fair few emergencies and disaster responses in my time, and I think one of the main things was the way that the community was rallying together at all levels. And a concrete example of that was just the sheer number of people who were offering assistance, whether it was their own expertise, their own connections with business, their own businesses themselves. There was a real sense that this was a whole of country response. And there's been some notable billionaires, most of them are miners, who have sort of had very, very forthright examples of that. But I got the impression that this was the whole of government and whole of country that was responding to this condition. The second one is that not, with the exception of a few pockets of the media, and really commentators at that, no one has questioned why we were doing this. And we were doing it because we knew this condition affected our most vulnerable in society. We knew this wasn't ripping through our children or our young adults or even our middle-aged adults, but this was something that really affected those in the latter years of their lives. But nonetheless, we recognised the importance of the response to protect them and to protect our frontline healthcare workers, whether they were GPs or nurses or hospital workers, because we realised as a community what the impact of not acting was. So I just wanted to cite those two things as really important examples of Australia coming coming together. A couple of notable government decisions, of course, but this was the biggest public health shift in behaviour that any of us will ever see in our lifetimes. And that is not about what the leaders do, that is about what individuals in the community choose to do.
Well, thank you both very much for those comments. And I think you're right. I mean, you know, there was certainly commentary around at the time that certainly in the early days that perhaps Australia's response had been slow. But I think you're absolutely right to point out it has been comprehensive, and, you know, the degree to which the community at all levels has mobilised around this, because it is a once in a century experience for all of us, from government decision makers down, as you say. Can I perhaps ask you then, you both pointed to the extent to which the community have mobilised, and what's at the heart of community? It's consumers, it's patients with families, it's all of the people that are affected by this right across the population spectrum. It's not something that's leaving anyone untouched, is it? So thinking about what matters most to consumers and the community, what do you think are the most important issues on the horizon now? Particularly, as you say, we can't be complacent. You know, we're all looking at that lovely flat curve and thinking probably we can be a little bit more relaxed. But for now, and the near term, the most important things on the horizon that you think the community and the consumer sector need to be thinking about?
I'll take that one, and again, I know Michael and I share a lot of these views. In the near term, people absolutely need to go to focus on their health from a non-COVID perspective. The important realisation that when you go to a health provider now, and I have been myself, I can tell you in the past week I've been to a dentist, I've been to my general practitioner, I've observed the processes that they've got in place, and I can tell you that people have prepared well for a COVID-19 2020, and they've kept their environments very, very safe. The ones that I've seen, I know not all of them will be like that. If you do attend somewhere that you don't think is safe, make sure you point that out. But really, the top thing from my perspective is people taking care of their health from a non-COVID perspective.
Did you want to offer there, Michael?
Yeah, so I obviously I agree there, and I think the other area that we've been focusing a lot on is on mental health, and acknowledging the incredible impact that this pandemic has had on our mental health as individuals, as carers. You know, I doubt whether there's a person on the planet who hasn't been feeling anxious about this pandemic and about the risks that it poses, either to ourselves or to people that we love, especially the older members of our families. And you watch the media, and the media, of course, there was blanket media for so many weeks about what was happening with COVID-19, both in Australia and devastating scenes from other countries. And then we have the impact of people having been in isolation and quarantine over a period of 6 weeks or more. And of course, many vulnerable people are still in isolation in their homes and being protected in case there is community transmission still occurring in their local areas. And we add to that the economic distress which has been caused to so many people through job loss, the huge rise in unemployment, the many industries which have closed down during that period. And so it is incredibly important that we get much of our economy up and running, and we have that balance between the health of our economy and the health of our population. But getting people back to work, getting our children back to school has a big impact on people's mental health and well-being as well.
I'm just going to go to some questions coming here through the QA chat, the QA, not the chat, the QA. We've got a few coming in. I'd encourage people to continue to do that. Just picking up and following through, I guess, on what both of you have had to say. We've got a comment here from Monica. saying so many lessons learned. How will these translate into the way we live in 2020, 2021 and beyond? For example, and this is a government-related question, I guess, but also from your perspectives, you've both worked, you're both there at the heart of this, working with National Cabinet and our decision makers. For example, National Cabinet and collaboration on whole of country issues. What are your thoughts on that comment about changed governance and you know, the potential to change the way that we tackle national problems as a learning from this?
Go ahead, Michael.
Thanks, Nick. Well, look, there are so many lessons which are learned, and I guess one of the things that we, you know, when you look back and you look at past crises, sometimes they lead to some very fundamental changes in society and the way that we live our lives, and sometimes we forget about what happens and we just go back to same old, same old. Well, we won't be going back to same old for some time, probably in Australia, as we wait for that elusive vaccine to appear and to be able to open our borders. I think that some of the lessons we've learned are about that importance of working together as a nation, as we've seen through the National Cabinet. It's been wonderful, frankly, seeing our political leaders coming together across party boundaries to work together for the benefit of the entire nation and the entire population. And that's been inspiring. And I also think that for many of us, what the going into lockdown has demonstrated to us is the importance of family and the importance of community. And, you know, many of us, of course, are missing dear members of our family and other loved ones who we haven't been able to connect with because the country has been in lockdown, people who are in other states, or we haven't been able to travel to see, or loved ones in residential aged care who we are staying physically away from to ensure that they're protected and not at risk of the virus, but using new technologies in ways that many of us haven't done before to make those connections. And of course, we've used that in healthcare as well with the rollout of telehealth, which is, you know, probably one of the biggest changes we've seen to the delivery of healthcare in Australia since Medicare was established all those decades ago. All of a sudden, your GP can reach out to you and do so using video consults or the telephone. You can reach out and have these consultations. So that's one measure which, you know, the Health Minister, Greg Hunt, already has said he expects this to continue in some form or other beyond the life of the pandemic. And I'm sure there will be many more. And the other thing I hope we don't lose, Leanne, is that beautiful sense of community that we've seen across the country with, you know, young people reaching out to their elderly neighbours, people they know who are living on their own, making sure people are okay, doing the shopping for people, having those driveway get-togethers in the street, or doing gym exercises on the balconies of high-rises. I was in my apartment the other day and somebody started singing opera from one of the balconies in the apartments in Potts Point in Sydney, echoing down the alleys, and it was just the most beautiful sense of something positive coming out of this. And of course they finished and the entire neighbourhood rises in applause, and then they kept singing.
Yeah, thanks. And it's heartening to see, the community response, isn't it? We've got a question here, just picking up again on your point about community and resilience in communities. You know, we were talking before we came online about the role that organisations like primary health networks have played here as well. Got a comment here from Peter Heggie. We've had a series. Some people have said we should just wipe 2020 altogether. You know, we've had a series of community traumas, one following the other. Climate change, drought, fire, flood, bushfires, and then COVID, all within, you know, a 6 to 9 month window. How might we best be repairing the community and prepare for the next trauma?
That's a fantastic question. And following on from Michael's response, I guess my experience in the past albeit never on this scale, is that you have to work hard to, I'm not going to say capitalise is the wrong word, but we all say we've got these lessons to learn, and we do. And as Michael said, there's things that we want to continue from this, and community cohesiveness is one of them. We have to resist the temptation. If we're going to get our community back on track, we're going to have to resist the natural human temptation to forget very quickly what things have been like. I mean, you know, the bushfires seem like a year or two away for all of us. And we can't forget the lessons that we need to learn from the bushfires, just as though we can't forget the lessons from COVID-19. So I think it's not a direct answer to the question, how do we continue to build community, but rather how do we preserve what we have built, which Michael's suggested, and we do that by not forgetting. The one other thing I would just build on is, you know, I had my father suffered from frontotemporal dementia and had a very challenging last 5 to 7 years of his life, including in a residential aged care facility. And keeping in mind my current position as a representative of the Commonwealth, I speak with a degree of caution, but maybe it's enough to say that I think we can take a much more positive, but also a focused look at how older Australians are part of our community, and the important role that they play in our community. And that would be the big lesson to take away from this. And just a personal anecdote, which was lovely. I find it very hard to get my kids to wash their hands even now. And on the weekend, when they're 9, 7 and 5, but they went to visit their granny for the first time, who's 73, and on the weekend, and were so careful. They went straight to wash their hands without being asked. They knew the importance of protecting the vulnerable and the elderly. So that just struck me, just on a personal level, as something that I think we need to preserve. And that does go to the heart, I said, of residential aged care facilities, as well as a part of our health system. And whilst I suppose on the flip side of what you might see me saying, which is, you know, you look at Newmarch and Dorothy Henderson, the other side of it, of course, is that there have been many, Michael might know the actual figure, I think it might be in excess of 30 facilities that have actually had cases of COVID-19 that didn't turn into Newmarch and Dorothy Henderson. So just on that level, they aren't performing too badly. But I think globally, care of our elderly Australians is an important thing to build on.
Thank you both for those comments. It brings me to a question we've got here from Penelope. It's interesting to hear that that there are 30 near Newmarches and near Dorothy. What was that other facility? Dorothy Henderson, was it the Rockhampton one? Yeah. Interesting to hear that, you know, we've averted many more than we've actually had. I don't think that's wide public knowledge. But a question from Penelope here related to some of those points you were just making, particularly around the vulnerable populations we need to care about, but the ones we also need to value more for other community connectedness reasons as well. So Penelope's saying, as the wider community becomes more complacent, arguably, I'm hearing from vulnerable people that their anxiety is escalating because they feel more at risk from the behaviour of others. Amongst the messages about reopening, what messaging can we anticipate from governments to emphasise that the pandemic is not over and risks remain, so and that vulnerable people will need to continue isolating or self-isolating to a degree and will continue to need protection and support?
So we really need to continue adhering to the measures which have been in place. And the most important thing that anyone can do to protect the rest of the community is, if you have symptoms of a respiratory tract infection or a fever, you stay at home and you arrange to get tested. You don't go to work, you don't go to school, you don't go out to the shops. And that way we are all protecting our own health and well-being, the health and well-being of our family and loved ones, but also the health and well-being of the wider community, because we're going to have to get used to living with COVID-19 for quite some time to come. And so that is the key message that needs to be out there. And if people don't adhere to that, or if people do start to get complacent and say, oh, these aches and pains and this sore throat that I've got, it's probably just a flu, and go to work or go and visit their grandma or whatever happens, that's where we're going to get outbreaks. That's where we're going to get continuing deaths related to COVID-19. That's where we're going to turn around all the benefits that we've seen in Australia come from the sacrifices which have been made over the last couple of months. So really important that people do keep adhering to these messages and don't forget that COVID-19 is with us. And you know, Penelope is right. There are a lot of vulnerable people out there who are still staying in their own homes. Some of them who aren't even willing to go and see their doctor, even though it's now been 2 or 3 months since they had their last appointment for for managing their chronic conditions, or they may not be going to the pharmacist to get their medications, their prescriptions filled. They may need screening and they're putting that off because they're worried. And we are seeing in general practice people who are starting to come back to general practice with long shopping lists of problems which have accumulated over the last 2 to 3 months and now need to be addressed, and some things which could have been addressed by telehealth while people were in isolation. So very important that everyone feels safe in our community, which means we all need to keep playing our part. And this is challenging. It is challenging for young people who want to get on with their lives at the start of their lives. You can appreciate that, and people wanting to get back to normal, but there is no normal at the moment.
Thanks, Michael. Nick, are you wanting to comment there? Or
well, I'm sort of wrestling a bit with the how, which I think is behind Penelope's question, because I suspect the message is clear to most. It's just can equally be ignored as well. And where do we sit with that? I think the clarity of our communication has to be crystal clear. And as you saw, Michael well demonstrating that with those comments. I think that there is an opportunity to take that sense of community that was mentioned before and use it. We should be mentioning to each other, to businesses. I went into a business on the weekend that didn't have hand sanitizer. I did point out that that was the case. I pointed out to one that did have hand sanitizer that it was great to see, and made a point of washing hands. So we can be exemplars about the behaviour that we want to see. The last thing, two points to finish. The importance of your own vulnerability being a shared thing with your general practitioner is really important. If you've got the sense that you are vulnerable and you just want to ask how you should lead your life in 2020, I would strongly advise discussing by telehealth, if necessary, with your general practitioner. There is, I look after a number of patients who, independently of COVID-19, because of their immune suppression, are vulnerable from respiratory viruses all the time. And so there are various consumer groups such as Cystic Fibrosis Australia and various other groups that really, where their patients and consumers get in lots of trouble with respiratory viruses, that have some good advice on how to deal with COVID-19. So those would be my messages there.
Thanks very much, both of you. And I've got a couple of questions now. I do want to come back to telehealth. There's a lot of questions about telehealth and where are we going to go with that and what can we expect with that, which I'm sure you won't be surprised about. But we've been talking about community mobilisation and the importance of taking personal responsibility. I just want to go to a more system level set of questions, I suppose, from a few people on the chat line, on the QA here, that speaks about consumer and community involvement in a more systemic way in shaping responses to these sorts of crises and indeed future policy. I'll just read you one of them that pretty well captures the essence of what several people have asked, including Anthony Brown as well. This one's from Susanna Morris. Both speakers have emphasised the importance of the whole of community response. In the crises, the population trusted the government to respond, and the response was granted legitimacy. To continue to hold that legitimacy, however, how will you act to ensure you carry the population with you as partners? Some departments of health have argued that they have had to adopt a command and control style operational approach, which consumers accepted in the eye of the storm. But moving forward, how will consumers be engaged in developing policies as consumer representatives, not just commenting on decisions once they've been made? Michael's nodding there.
I'm happy to go first. It's a really important question and a really important issue. And I just want to reflect for a moment, Leanne, on the lessons that we learned from the last great pandemic, which you and I lived through. Perhaps many people online didn't, but that, of course, was the emergence of HIV/AIDS in the 1980s. And just reflecting on what we learned, and for me as a very young doctor at the time when HIV/AIDS appeared, you know, one of the great things that came from it was the strengthening of the consumer movement, that whole ethos about nothing about us without us that came through with HIV/AIDS, and the tackling of stigma and discrimination and the human rights for many vulnerable people that sort of came out of that particular pandemic. And I wonder what will come out of this pandemic. And you're right, one of the questions I've been asking myself is, over the past 3 months, was there enough consumer input into many of the decisions which were being made about Australia's initial response to COVID-19? And in some areas there were, you know, with the development of the primary care response to COVID-19 and the rollout of telehealth, the rollout of general practice-led respiratory clinics to test people. A lot of this was built on all the work which government had been doing over many years about primary care reforms. And of course, CHF and other consumer groups were integral to that thinking. And so the principles which came forward were principles which had been driven by consumers as part of that process. And I think that we need to make sure that as we come out of this phase of the pandemic, that we don't forget those lessons, and we don't forget the importance of engaging, and we don't forget the importance of having the consumer voice in the decisions. Because if we do, then we'll come up with solutions that just won't work for the people of Australia, and people just won't be able to implement them, or we will miss out on addressing the needs of particularly vulnerable groups of people in Australia, or groups which traditionally don't have a very strong voice. And this is what the consumer movement is all about. It's about making sure that everybody has a voice, and making sure that the decisions which we're making are based on principles of equity and fairness, which are so fundamental to healthcare delivery in this country and so much else.
I mean, I think from my perspective, it's the opportunity again of the crisis to shape one's own health system moving forward. So just as the government has been given the leeway of trust in a way, and to take the nation forward with it, I think, to paraphrase the question, it's also the time when government is going to be open to listening very much about how these are constructs like telehealth, because that's the sort of example du jour, but there are others, residential aged care, anything really where you've seen some substantial impacts of this COVID-19 epidemic. I think there's an opportunity to shape our system going forward. So I would simply say to people to take that opportunity, and government is listening. You've got people, you can hear two of them today, who are within government who do share the same view on consumer input into healthcare design and systems, and now's the opportunity in the coming weeks to months.
Thank you. You've touched on issues of equity of access, both of you there and throughout your other comments. We don't have a vaccine yet. Lots of hope being put in that. Question here, when and if a vaccine eventually does become available, will there be a similarly well thought through and planned approach so there's equity in access and no one gets left out? Oh, my question has just flipped. Yes, it seems to me that planning for this needs to start now so we're well prepared. Some thoughts and insights from you on that one.
I couldn't agree more. And there's some general principles that have always underpinned the distribution of vaccine in this sort of context, but never had to be implemented before. So I think Michael's might be able to have some stronger insights than me from his experience in Canada with SARS. But oftentimes you'll consider your frontline staff, the healthcare workers, as early recipients of things like vaccine. But then thereafter, I think, without going into the specifics of vaccine allocation, one of the things we've been, that the government, and you know, some, depending on where you sit on your political views, some might have been quite surprised at some of the responsiveness of government in this particular pandemic. But one of the things that I would cite is the real early focus and recognition of vulnerability of our Aboriginal Australians, and particularly those in community. And that extended to Australians in rural and remote areas. There was a very early recognition that whilst we couldn't put intensive care in every part of the country, we could, though, restrict movement in and out of areas, and we could ensure, we've just had discussions recently again about the quick rapid turnaround testing in rural and remote areas, and sort of tens of millions of dollars into aeromedical retrieval, RFDS, and other aeromedical retrieval providers. So I think that, to me, provides a lot of reassurance that government has an eye on equity in access to care and vulnerable groups that may, and stopping vulnerable groups from falling through the cracks. But Michael might be able to be more specific about the vaccine question.
So again, I think it's a really interesting question. And, you know, we don't know whether the vaccine is going to come to Australia first or if it'll go to other countries. So it may well be that Australia, being in the position that it's in, goes to the bottom of the list for vaccines. There may be other countries where the equity issue is far more imperative than it is here. And then when we do start rolling out the vaccines, fortunately, we have in place in Australia very effective ways of vaccinating our population through general practice, through pharmacies, through our Aboriginal community controlled health organisations, through programs to make sure, as we have with influenza this year, every resident of residential aged care has been vaccinated and nobody misses out. And then, of course, there are the priorities for the people who are most at risk. We don't want a toilet paper situation with the COVID-19 vaccine. You know, we want the people who need it the most, as Nick has said, to get it: the elderly, the Aboriginal and Torres Strait Islander people, the people with chronic disease that puts them at greater risk if they get COVID-19. And our healthcare workers and our aged care workers and our disability care workers and our home care workers, the people who are coming into contact on a regular basis with all those people who are more vulnerable.
Leanne, I'll just put one other point there, which is something that I've been mentioning a bit on my Facebook updates and other fora, which is there's only one vaccine that's ever eradicated a disease from the globe. So I think the expectation that COVID-19 vaccine would be equivalent to smallpox is is one potential outcome, but it may be quite a small likelihood that that would occur. Then you've got, is this going to be like measles vaccine, where you can vaccinate up to 90% of the population, and effectively you have occasional incursions of the virus on a very sporadic basis? We'll have to see about that. Is it going to be more of an influenza type vaccine, whether there's a seasonal component to it and it has a reduced efficacy compared to measles vaccination, but it certainly decreases severe disease? Or the final option, of course, which is one that we'd rather not consider, but is equally a possibility, that this COVID-19 virus may not be able to be vaccinated against. So any one of those possibilities might occur. And I just want to sound, every time I talk about vaccines, I sound that note of caution that we are in very, very early stages. We have the advantage of being in 2020, so our technology is better. And we have the advantage of being somewhat paradoxically in a global pandemic where every nation has an interest to actually divert their resources to solving this problem. So I'm encouraged by that, but we just need to be a little bit circumspect about the vaccine question as well.
Thank you very much for pointing out the nuances there in the conversation and the expectations and hope we need to put around the vaccine. I suppose it highlights, doesn't it, and there's comments and sentiment coming through. We've got about 39 questions in our Q&A box here, and I'm just scanning them as we talk. We're not going to get to them all, but to reflect some of the sentiment, there's some comment coming through, particularly around, we shouldn't be underestimating the remaining levels of fear and anxiety in the community about going to your doctor and maintaining your usual care. That's certainly still very much there in the psyche of many, many people. Just on the point though of treatment then, if notwithstanding your comments about the vaccine, but we're still learning a lot, aren't we, about, and still a lot we don't know, correct me if I'm wrong, about how we can treat and manage this virus. You hear commentary every day about that in the media. If consumers in the community wanted to know how that's evolving, what does work, what's showing promise, is there anywhere they can go? Where can we find that information?
There's a variety of excellent resources. I think at a supranational level, the World Health Organization generally has some good information on this. There is, and I'm going to get the website address up right now. Yes, now it's covid19evidence.net.au. I'll say that again, covid19evidence.net.au. Now that is a group of clinicians and nurses and various people involved with healthcare who are looking at what's called a living guideline. Now, there was only one of those before. I think it was funded by the Commonwealth, and it was a living stroke guideline. Now, the concept of the living guideline is that they have a task force that's looking at the evidence, and they've just supercharged this to do it on an almost daily basis. And so they have what I find to be quite a straightforward application that you can sort of trace through, and you can find the drug hydroxychloroquine, you can find the drug remdesivir, all the things that you're hearing in the media, and then it will give a recommendation on I think it's actually the probability of a patient saying yes. I'm not quite sure how they do it, but there's a very interesting sort of terminology that they use, and unfortunately most of them say unlikely to be used outside of a clinical trial at the moment, but that's a good place to look. And Michael might have some other resources, and then I might specifically talk about hydroxychloroquine and the media in the past 24 hours.
So I think it's important to remember that the majority of people who contract COVID-19 don't need special treatment. People are being managed at home. They do need to be obviously in isolation and protecting their family members, but there are many people who are getting their care from their GP or from community nurses and doing that largely through telehealth and largely through managing symptoms. It's only when people get severely unwell, which is a small percentage of people that we're looking at these different treatments which are being proposed. And of course, most of them, as Nick has said, are being proposed as part of research studies rather than being anything which has been shown to be particularly helpful, apart, of course, for the supportive measures which happen in hospital to look after people's well-being.
That's exactly right. Well, it's a very good point, Michael, that most people aren't hospitalised and won't require the treatment. The hydroxychloroquine, just very briefly, is an anti-malarial drug. People may know it from its use in rheumatoid arthritis and other autoimmune conditions. There was a study that came out overnight in the Lancet that studied tens of thousands of patients. It took its data from registries, so it wasn't actually a clinical trial where the investigators were giving these drugs to people and a placebo, but nonetheless, it had some results that have provoked some concern. Now, hydroxychloroquine has effects on the conduction system of the heart, and we know that COVID-19 seems to have, as some respiratory viruses do, a tendency to cause cardiac inflammation, and it's plausible, it's possible that the interaction of the drug side effect and the virus itself might lead, and I say might because this study does not prove this, it just suggests that it may be a problem, that this might lead to an increased mortality due to heart problems, specifically heart rhythm abnormalities. So we are considering that. I've had a number of calls today on that specific issue with the TGA because, of course, there are a number of trials in Australia that use hydroxychloroquine in their treatment arms. I think we can be reassured that those investigators of those trials are amongst the most senior investigating clinicians in the country, and that they're overseen by specific human research and ethics committees, that if the evidence is sufficient, would ask for those trials to be stopped. But at the moment, there wouldn't be sufficient evidence based on that single study. That'll be being considered as to whether that is sufficient evidence to stop the trial.
Thank you very much, and we will be posting a recording of this webinar, and that website that you mentioned, Nick, will post at the same time. And we were talking about consumer involvement in COVID-related matters earlier. It's the Living Evidence Consortia and Task Force is one that CHF is involved in. We've just in recent days nominated 2 consumers to participate in the governance leadership group for that, and a consumer panel, a very diverse consumer panel, to work with clinicians to review guidances and hopefully translate or help to translate some of those into more publicly accessible language as we learn more about treatment and management of COVID. I'm going to have to turn now to telehealth because that's a burning area of interest for consumers. A whole battery of questions here. We're now up to 45 questions, guys. So telehealth, on the whole, I think it's been enormously welcomed. It's helped combat some of the fearfulness and anxiety that people have expected. We're obviously still dealing with the digital divide. Some people are much more comfortable, including clinicians, I would suggest, using telehealth as a supplement, or in this case, probably a substitute for face-to-face consultations. The questions here are also about are there going to be standards introduced? So I suppose if I had to summarise what the questions are about, it's about, first thing, is the government going to do anything about evaluating the consumer and clinician experience of telehealth? Is there a commitment to continue those telehealth and improve and strengthen them beyond September? Is there planning or thinking being done around standards for telehealth? And then the fourth component of this, I suppose, is what is the status of the new or developing 10-year primary care plan? what impact will COVID have on its development? And I'm asking that because it seems to me that nesting telehealth, at least as far as primary care goes, into that plan makes sense. But obviously there's telehealth occurring in the specialist and acute and outpatient world as well. So very keen to hear about telehealth and its future.
So I might start off, Leanne. Yeah, we're all keen to know what is going to happen with telehealth beyond the 30th of September. At the moment, the current arrangements that we have with the Medicare benefits schedule item numbers go until the 30th of September, and then they're to be reviewed, depending on, of course, what's happening with the pandemic in Australia. As people will know, those item numbers were introduced in a staged way, initially to provide care for people who'd been diagnosed with COVID-19 or who'd been tested and were in isolation waiting for results, then for people who were vulnerable according to the criteria used by the Medicare benefits schedule, then for clinicians who themselves were vulnerable so that they were protected, and then the whole of population approach that Minister Greg Hunt announced, which allowed every Australian to be able to reach out to their chosen healthcare providers, or their healthcare providers to reach out to their patients. And all the way along, we've said that telehealth can only be used for some of the things that we do, and that providers need to have the ability to provide face-to-face care when that is required, because very often, of course, there are things that people need in their interactions with their healthcare providers which can't be done by telephone or a video consult. You have to be in the room together to examine someone, to carry out certain procedures and so forth. Also, the telehealth has been expanded from just being delivered by your chosen GP to being accessible to other specialists, to allied health providers, to community nurses, to Aboriginal health workers, and to others. So there's been a lot of interaction, and I think that it has been such a boon both in delivering healthcare, but also in addressing those mental health concerns which some of your questions have addressed around people who were isolated. Because, of course, not everyone was in isolation with a loving family. Many people were in isolation on their own with limited access to other people as well. I think as we are now moving out of the lockdown and the restrictions are starting to be lifted, it is really important. And Leanne, I think your members have a really important role here with the reach that they have to so many people out in the community, to please encourage everyone to reach out to their regular health provider to arrange an appointment, to follow up on their care, and whether that's by telehealth or by face-to-face consultation will be something that will be decided between each consumer and their healthcare provider. But one of the points we've made right from the start of the pandemic is experience from past pandemics has shown us that often you get more morbidity and mortality from non-pandemic related health issues than you do from the infectious agent itself. And it's really important that people with acute health problems are getting those addressed. People with chronic health problems are getting their continuing management as they always do. People with mental health concerns are getting their continuing therapy and treatments as well. And that we are also continuing to do our preventive health measures, taking our children to get their vaccinations, doing our cancer screening now that the breast screen and cervical cancer screening and the bowel cancer screening programs are all running again, so that we don't have more people who are getting really sick and potentially dying from other problems which could have been preventable than we do from what's happening with COVID-19. The question about research, there's a lot of research underway, including from my own research team at the Australian National University, looking at what's happened with telehealth. There are some great reports which have already come out, and they will inform what happens next. And I think the issues around the quality of care are really important. I know that many of the professional colleges have issued standards for their members about how to make sure we're using telehealth and using it appropriately, and when is it not appropriate to have a consult by telehealth? When do we have to say, I'm sorry, you have to come in and have an appointment? And the other area is around the 10-year plan, which of course you're part of, Leanne, and CHF is one of the key players in steering the 10-year strategic plan. I know some people have said, you know, we have a 10-year strategic plan and we rolled out some of it in 10 days with the introduction of telehealth, but there are a whole lot of other measures which need to take place as we reform primary health care in Australia and as we support team-based care and make sure we're addressing the equity issues, making sure everyone is getting access to high-quality primary care in Australia. Telehealth is one component of that changing model of care, but only one. And so there are a whole lot of other things which need to be incorporated into those ongoing reforms.
Thanks, Michael. And it's worthwhile mentioning too that, you know, patient readiness and, you know, digital literacy, if I can use that term for telehealth, is important. There are some really good resources on Health Direct's website and I think the Digital Health Agency's website as well, targeting consumers to equip them to get ready, I suppose, for a telehealth consultation and to be a bit, you know, more aware of what to expect, because it is different to a face-to-face consultation. I'm just conscious we're down to our last 4 minutes. We're not going to get through all our questions, but I think we've covered a fair spectrum today. We will do our best to theme those up and work with the department to get some answers out in relation to the remaining questions, along with a summary, along with the posting of this webinar on our YouTube channel. I'd perhaps like to ask by putting a last question to both of you, just very briefly, and we've touched on mental health and loneliness and primary care reform. You know, we've seen unheard of, you know, there's a comment here from Dean, you know, what could have been unheard of deployment of, you know, private hospital assets into public hospital delivery as a result of this pandemic. You know, it really has taken some of the constrained thinking away, which is very heartening that we can be innovative and find new ways of working when we really need to. So just on that note, if I could take the last couple of minutes to take a final comment from both of you on what strikes you as probably the one or two single most major implications of the pandemic in terms of future health policy.
Wow. So the most thought-provoking to last. Well, the first thing I just take the opportunity in the last 30 seconds or so just to thank you, Leanne, for hosting. And in particular, you know, we do a lot of these webinars, but you can differentiate them by how many questions come through and how enjoyable those questions are to answer. And I have enjoyed answering, so thank you. I think for me, as an infectious disease physician and respiratory physician, if the policy implication of this can be that my patients and consumers are safer from all other nosocomial infections, from seasonal influenza, from respiratory viral infections in general, from resistant organisms in hospitals and other healthcare settings, that would be one of the important ones for me. I know it's not one we've brought up on today's webinar yet, but I think it's critical, because what hopefully this will make us realise is that there's so much preventable morbidity and mortality within our healthcare system already, and that I know that doctors have gone from washing their hands 50% of their time to wanting to wrap themselves in Glad wrap before they come to work. But in all seriousness, it's a lot better than it was even 3 months ago. So that's good news and needs to be maintained.
And just very quickly, Leanne, again, thank you to you and to the CHF. I think the most important thing is that we learn the lessons from COVID-19, and I think the consumer voice needs to be really strong in identifying where has our health system worked really well in responding to this pandemic and what didn't work well, what were the failings, and what do we need to do differently in the future. So we need your voice, we need to hear what you think.
Well, thank you both very much. And I think it goes without saying on behalf of CHF, there hasn't been, there's been an enormous number of issues that our members engage with us over the years, but the level of interest and engagement on this topic, both, from looking at the ethics, looking at the health service delivery implications, the future health policy implications, is enormous, but heartening and energising at the same time. Our board is meeting at the end of this week, and we're certainly going to be looking at how we can mobilise and coordinate with our members. We're very keen to put a consumer-led blueprint think piece to government about consumer and community views around the learnings and the opportunities for this. That's what we do as a peak body, so that'll certainly be coming your way and the government's way. But can I thank you both once again? Really appreciate your time. We know how busy you are, but thank you very much for that, and for your expertise and your considered insights and comments this afternoon. Thank you.
It's a pleasure, Leanne. Thank you.
Thanks, Leanne. Thanks to all your members.
Our participants online on behalf of CHF. See you later. Thank you.
All the best.